Thank you everyone for joining us tonight. We wanted to let you know that this live will be a little bit shorter than normal as Dr. Sojanko has to be on a call with the state. Without further ado, I'm going to let Dr. Sojanko and Joe Lynch take it away.
So good afternoon and thanks for joining us on short notice. Again, I'm Eric Sojanko, I'm the County Health Officer. I'm here with Joe Lynch.
Joe Lynch, Division Director of Administration for Health and Human Services.
And we had not planned on doing a Facebook Live, but a lot has happened in the last 24 hours, and we felt it would be important to get that message out as soon as we could. And we know that Facebook Live is a fairly efficient mechanism for us to do that. So what I'd like to do is just start with the things that have happened in Mariposa County over the last 24 hours, and then kind of give a picture of the region and the state. Then talk a little bit about new guidance that the governor announced on his press conference at noon today. And then I'm going to hand it over to Joe for a bit to talk about the Family First Coronavirus Relief Act and some other subsidies, some other help that is out there to mitigate the impacts of what we're seeing with the workforce. So first, let me start with probably the issue that's most on people's minds today is we do remain currently in containment in Mariposa, but we had 2 cases over the last 24 hours, which are kind of knocking at those boundaries. Case number 32 was identified yesterday afternoon, and we immediately began contact tracing. But because of the identification of the case, she reached out to her employers, and because we're working in conjunction with the employers, I can let you know what happened and where it happened, where there may have been possible exposures and where there weren't. So this person was working at 2 restaurants in town. One is Steve Sportsman Cafe in Woodland. She was working there on the 9th and the 10th, but she was working in what we call the back of the house or the back of the restaurant. So if you were a customer in that location, you aren't at risk and you don't need to quarantine and you don't need to get tested. So that's something that our contact tracing team learned today. So again, if you were at Steve's, no concern for you at this point. However, working in conjunction with Steve, we are going to have them do some deep cleaning, and we have quarantined some of their staff. And based upon the staff that's not quarantined, he may be able to open up after having done deep cleaning that meets the standards set by the state and will be looked at by our environmental health team. The other restaurant that was of greater concern for our general public was Castillo's. And the person worked there on the front half of the house as a server on the 11th of July, which was Saturday, from 11 to 3, so lunch service. And we know that there were 19 tickets for that time period. That is 19 sets of diners that were eating there. So if you were one of those, what we're asking is that you sort of self-evaluate. What we define as being a close contact is someone that may have been in contact within 6 feet of that person for 10 minutes or longer, and that doesn't have to be 10 continuous minutes, but over your stay at that location, if you felt like you were in close contact for a total of 10 minutes, then you may need to go into quarantine. And we would ask that you call our COVID hotline, which is 209-259-1332, and we'll repeat that at the end of the Facebook Live as well. But again, area of concern there is Castillo's on Saturday from 11 to 3 if you are a customer being served at that point in time. So that's case number 32. We're continuing to do contact tracing associated with that and going through some other associated cases we may. We are likely to have more positive cases from this, but we feel at this point we have a fairly good sense of where the case got her transmission from, And we're working on cutting off that chain of transmission and keeping it as well contained as possible. The other case number 33, we found out about late last night, almost early this morning. And that was a person who became symptomatic on Saturday. And we've been doing contact tracing and investigation associated with that. But more details to come. That is still very much a work in progress. But we feel like we've got a good handle on it. The other thing that I wanted to mention tonight as far as results in Mariposa County is we received our first set of positive results from BioBot. And BioBot, as you may remember, is our wastewater testing system. And we send samples off from the El Hotel treatment plant that gets wastewater from Yosemite Valley, from the Wawona treatment plant, and from MPD here in Mariposa. For the samples that were sent off on the 7th of July, all 3 of those locations tested positive. So that suggests that where we hadn't had positives with just residents, just based on our 4th of July visitation to the area, we had a number of people coming in from outside the area, in addition to people who were recognized during our own contact tracing and case identification that were positive. So that points out the need, as always, to be vigilant, because not only do we see it in our cases that we identify through laboratory testing, but now we're seeing it in the wastewater that we're testing. So that suggests that we have ongoing exposure from visitors. And so we need to be doing all those things that we talk about on a regular basis to limit the transmission of spread. So that's kind of what's happening in Mariposa. If we look at the broader Central Valley, San Joaquin Valley region, we're seeing a lot of hospitals going into surge. And we're seeing about 16 to 18% of some hospitals, their ICU beds and their medical surgical beds being occupied with COVID positive patients. So that's concerning for the demand that they put on the system. And you layer that on top of all the other people that are getting sick or who are involved in motor vehicle crashes or who otherwise use the healthcare system. So that's creating a weight in our system. And it's also required the opening of what we call alternate care sites. Specifically, the state has opened an alternate care site in Porterville and Tulare County, and that's taking people that have made it through their acute care hospital phase and need some rehab afterwards, and that's the specific function it is fulfilling. But we are likely to see some alternate care sites open up in other counties to take care of acute patients in addition to rehab patients. Over the state, we're seeing the same sort of pattern, increase in the number of infections, increase in the number of hospitalizations, and a slow upward trend on the number of deaths. So that prompted the governor today to increase some of the restrictions or mitigations that are put in place, both statewide and then in some of the states that have, or correction, some of the counties that have been in the data monitoring list. So up on the screen, you'll see those restrictions that are put into place today. And it again applies to all counties, including ours. So restaurants can do outdoor dining and takeout, but no dining in. For wineries and tasting rooms, they must be closed if they have indoor operations. So if there's a tasting patio, if you will, if a space outside that they can do that, that's fine. Doesn't apply to us, but movie theaters and family entertainment centers are closed for indoor operations. Zoos and museums, again, zoos doesn't apply to us, but our museums can only do outdoor operations. And then again, we don't have any card rooms, but in adjacent counties where they have them, those will be closed. The bottom line, I think, is probably relevant to all of us in terms of how we split the lines on this, but the state made it clear that for bars, brew pubs, breweries, and pubs, They must close both their indoor and outdoor operations unless they offer sit-down full meals. And then what they can do is they can sell alcohol in conjunction with the same transaction as a meal. And again, that meal must be served outside. So those are the guidances that apply to all of the counties, including Mariposa. But what I also want to make people aware of is that layered on top of those are the restrictions that are being placed on the counties that are on the monitoring list. And that is to, in addition to all those other things, we'll close fitness centers and gyms, not allow for indoor places of worship, we have to move those outside, would have to close down offices for non-essential sectors, close down personal care services, hair salons and barbershops, and then the outside portions of malls. So those things are already happening in adjacent jurisdictions like Merced, Madera, and Fresno. And so what we want to make sure that we're doing so we don't get into that realm is continue doing what we're doing, which is wearing facial coverings, doing good hand hygiene, staying away from sick people, staying home if you're sick, not touching your hand, your nose, your mouth. And one thing that I really truly want to emphasize and kind of clarify is avoiding gatherings. What we've seen with some of our cases is that they've had large family gatherings or large gatherings of families and friends. And the problem is that you may have a group of people that you know and in normal times would associate with freely. But what you have to always consider is the risk that that person may have been exposed to COVID and may be spreading it without any symptoms. And we've seen that in a couple of cases here in Mariposa. So the better thing is to stay in as tiny a bubble as you can to keep everyone as safe as possible, to ensure that we don't go into surge in the county, that we don't see an extraordinary number of cases. Now, the other thing, and Joe's going to talk about this a bit in just a moment, is if you are employed and you do get sick, there are means, there are ways to keep you, to keep our community safe, but also keep you compensated for the time that you're spending away from the work site because you're either in isolation, because you're symptomatic, or because you're quarantined, because you've been exposed to a sick person. So Joe's going to talk about that for a bit.
Yeah, good afternoon. So the Families First Coronavirus Response Act was passed a few months ago, and it was designed to allow people that had health issues, childcare issues, or need to quarantine to receive pay while they're staying home. And I think the easy question is, why would someone go to work if they're sick and risk other people? It's because they have bills to pay. And I think what's happened in Mariposa since March, I'd like to thank Dr. Eric, our JIC team, our Joint Information team, and our town for educating yourself. And so this is just one more piece of education to say that Family First Corona Response Act allows for 2 weeks of pay for all employees that have been employed longer than 30 days at their place of work. So for all governmental agencies, there's an additional 10 weeks of leave. And for any business greater than 50 employees, there's 10 weeks of leave. And if you're less than 50 employees, you still get the first 2 weeks of leave. And then after that, we have many different packages, benefits. Just today, the Calaveras Mariposa Community Action Agency received almost $100,000 to help with rent and bills for Mariposans in need. These are the types of things that are available already. So if you're having to make a choice between, I need to make a paycheck because I have to feed my family, I have to risk going to work, you don't need to make that choice. You can call us here at 966-2000. We can either walk you through the Family First Corona Response Act leave, which is 100% pay for the first 2 weeks, or we can walk you through any of the benefit programs that we have. So it's very simple for you to say, if I'm not feeling good, I will stay home. I'll keep Mariposa safe.
I think that's all we have in terms of an update, and that leaves us about 14 minutes or so for questions, and we'll do our best to answer them. I don't know if we've got questions coming in already.
We do.
Super.
All right, our first question. Are the cases coming from outside the county?
So the answer is that the cases that we're seeing over let's just go back to the last two cases, is that they are, the last one is still under investigation, but we suspect that that may be related to a family exposure, either at a gathering or at a smaller family outing. And then that person we feel is a healthcare worker, but that again is still under investigation. The case that is number 32 is related to exposure to, again, a family member who resides outside the county, but was associating with a resident inside the county. So you're seeing that relationship of family gatherings. And then going back a little bit further, what we've seen is places where people recreate and commingle between the Central Valley and Mariposa. So as an example, our reservoirs is a place where we've seen a number of exposures coming up. So all the cases reside within the county, but it's that mixing of either family members or recreational sites that seem to be the common thread at this point.
Right. And the next question is the back of the house, in reference to case 32, they still touch things.
Correct. So we're really, and so I'll talk about the sort of three ways that we talk about transmission. And the most prominent is droplet spread. That probably accounts for greater than 90% of transmission of COVID. So that's why Joe and I are wearing facial coverings, because these aren't going to filter out a virus, but they will filter out the droplets and prevent the spread. So you probably heard a lot of talk about aerosolization. Those are tiny, tiny, tiny micronuclei that float in the air longer. And there's some concern about that. So it's probably about 5 to 6% of transmission. And then fomites is the stuff that they touch. And that again is a very low percentage. And so at this point, based on that low percentage and then the transition, we don't feel like there's a need to quarantine those folks that were at Steve's.
Right. Our next question. So she was sick on Friday and still worked on Saturday.
That's correct. And that's something we need to message better to our restaurants, is we do want to reinforce the idea of febrile respiratory illness screening. And that's an onus not only on every restaurant, but every business in the county, is that we ask before the beginning of the workday, do you have a new worsening cough, new worsening shortness of breath, a fever, or any other of the signs and symptoms that are associated with COVID? And if you have any of those, like Joe says, the smarter thing is to stay at home. And we've got means to compensate you for that. And so we ask the businesses to do that. We also ask individuals to do that well and take on that individual responsibility. If you're sick, let us support you, but stay at home, stay safe, keep the community safe.
All right. So food handling by a sick person is not a contact vector.
So again, a close contact, most ways of spreading this, or the greatest way of spreading this, is through droplets. And so droplets are within 6 feet for 10 minutes or longer. And again, it doesn't have to be 10 continuous minutes, but it can be 10 minutes over a period of time. So food handling per se is probably a very low risk. We've seen that with other outbreaks. Again, largest risk is droplets, then probably aerosolization, then probably fomites.
Okay. Can Airbnb rent at this time?
Yes, that's a great question, because in discussions that we've had with the California Department of Public Health, they are looking at the short-term rentals and the lodgings as a possible mechanism to reduce travel, to reduce transmission. But at this point in time, we haven't seen a change in that. But what I ask you to do is sign up for our sector-specific emails and updates. And you can do that by emailing Mariposa COVID-19 at gmail.com and say which sector you're in. And then we'll email you updates or text them to you as they happen. So we did that this morning when we first heard about the modifications that were put out at noon today.
If a person goes into a restaurant to grab a to-go order, but the person giving it to them doesn't have a mask, is that high risk?
So no, again, the sort of the contact time, so you want to think of it as time, distance, and shielding. So time is less than 10 minutes, you're probably okay. Distance greater than 6 feet, you're probably okay. Shielding, again, that's where the face masks, the face shields come in. So obviously the optimal thing is you're staying completely away from a person, not getting in within 6 feet of them, so you're out of risk. And then in terms of time, keep that time as short as possible. And then shielding, again, getting back to the masks. And whenever I talk about masks, I also want to talk about hand hygiene, because when you take that mask off or put it on, you want to be doing that with clean hands.
I just a point on that, Dee. It's greater than zero risk, and that's what we always talk about, from low risk to high risk. So if you go in and somebody doesn't have a mask, it's a higher risk than if they did have a mask, but it doesn't necessarily make it high risk.
Do we know if the 2 cases were wearing masks while they were working?
So with the case number 32, the answer is no. So again, that is a message that we need to put out to the community, that there is really no risk to wearing a mask on a day-to-day basis for most of the population. And so there's no reason not to, unless you've got a pre-existing medical condition that limits you from wearing a mask. And then with number 33, yes, he was wearing a mask while at work.
And I think we answered the last time, but I will just follow up. If you have a medical condition that stops you from wearing a mask, you should be wearing a face shield. And we also have those available here at Health and Human Services if you need one. Again, 966-2000.
Can restaurants still offer alcohol with to-go food orders?
So that's something that we've asked for a little clarification from ABC on, but my take is that the guidance that we were given today is very similar to what we had when we were in stage 2.5 or whatever that was, so the intermediary stage. And that is, you were allowed to have a beverage while you were waiting for your order, but you weren't allowed to really linger. And so, again, the intent is not to completely shut down an operation, but again, as Joe says, reduce that risk. So the longer you're in a space, the longer you're likely to share those droplets with other people and spread disease. So, if you're waiting for a meal at a place that's licensed to sell alcohol, you're okay to have a beverage, but you shouldn't spend excess time there.
Are wineries and tasting rooms able to do outdoor services?
Yes. So Chris, great question. I think I mentioned that. So you can do outdoor tastings. The idea is, again, they don't want to shut down businesses, but they want to encourage social distancing, and they want to do it outdoors because we know that outdoors is safer in terms of UV lighting and creating air currents so that you don't have still air and that you're absorbing those droplets, or more likely to absorb those droplets.
Do you expect any changes to the local short-term lodging order?
So as I mentioned earlier, not right now. We've talked about it with the state. But so what I'd say is, like I said, with the other person who asked about short-term rentals, is sign up for our sector-specific emails and updates. And again, Mariposa COVID-19@gmail.com is a place to go to sign up for that.
We are getting visitors from outside of Mariposa County that are much worse. Are we going to stop this?
So at this point in time, no. And I don't anticipate that will happen. I won't say soon, but that again is one of the discussions, is how do you limit travel from areas of higher transmission to areas of lower transmission? And how do you make people self-aware? So we know people are healthy, they can travel, and we need some of that to keep our economy going. The question is, how do we balance that with the risk that we put upon ourselves in terms of disease?
If the person working at Steve's was supposed to be quarantined, how was she able to work at Castillo's?
So we didn't know about her until yesterday afternoon. So you can't put someone in quarantine until you know they're sick. And actually the right term is isolated. So let's be, I get those confused all the time myself. Isolated is for people who are sick. Quarantined are for people who are contacts. So in this case, she should have been isolated. And what we really encourage people is that when you develop those symptoms, isolate yourself. You can self-isolate. You don't need to wait for county health to call you and say, hey, you need to be in isolation, and then arrange for testing. And that would have been the prudent thing to do. However, because she didn't do that, she went to work. Again, that's why we're messaging about the Family First Corona Relief Act, which allows you to stay at home and still get that pay so you don't feel obliged to work.
Will the county begin enforcing the facial covering rules? There are local businesses who interact with the public whose employees and staff are not wearing facial coverings or shields.
So at this point, we've talked a lot with the sheriff, and again, our focus is still on education. And then the other thing I'll say, it's an individual mandate. So businesses really aren't responsible for enforcing it on customers. But there are some businesses that are required by the state to enforce that amongst their employees. And so as you're seeing concerns, let us know here at the JIC, and we'll message that back to the sheriff.
I do know, I think last week when we talked to her, it was 2 weeks ago, the governor did create a task force that was comprised of OSHA, the Alcohol Beverage Control, and CHP, California Highway Patrol. And I think the state knew it was very difficult to do an individual mandate enforcement county by county. So they created a task force for the state. I don't know where, when, or how they'll approach this subject, but what I have noticed is out in our community, more and more people are wearing masks, and it's encouraging.
Yeah, no, I think that is the good thing, is we've seen people wearing masks, let's say, more comfortably. It takes getting used to. And then the other side of that, and getting back to Joe talking about the task force, is that we do know 2 restaurants in Clovis were shut down by ABC. And we've seen ABC up here before when we were back in earlier stages and issuing citations. So there are those state entities that will be out and about that will be working to ensure that the health officer's orders are enforced.
So a business has to provide leave even if they cannot afford it for 2 weeks. They have to do this even though it would close the business.
The only exemption to the FCR, Family First Corona Relief Act, is for childcare issues. So there's 2 facets of it. One is a 2-week leave, and one is a childcare leave or caring for someone that's sick if the schools are closed for 10 weeks. If you have that issue, please contact me, Jay Lynch, at mariposahsc.org or Tara Schiff at mariposacounty.org, and we will assist you with that. The exemption is if you would close, but not necessarily for the first 2 weeks, but allow us to try and help you get through that. Our number one goal is to not have employees come to work sick and make customers and other employees sick. The risk that we face, kind of the larger risk, is if we continue to have cases or we aren't self-monitoring ourselves, is we will be like the 30 counties that had additional closures, and that's really what we're trying to avoid. I think kind of all of our lives and all of our Zoomings have been, the longer we can avoid these things, the better for our community. You guys have done great so far. So just give us a call and we'll help guide you through.
How long will the Silver Road site be open?
So it's a month by month, and so we know that it'll be open through the end of August at this point. And we're hoping to keep it here throughout the length of the pandemic. And as a reminder, it's not going to go away anytime soon. We should be, in this pandemic, at least for another year. Hopefully we get a vaccine out as soon as December, but then it's going to be having to get into people's arms. So again, the testing site month by month, but we know it'll be here through the end of August.
Yeah, and just recently we applied for a CARES Act. I think you've heard me talk about that before. The county's going to get about $2.6 million. It went up slightly. In the next couple of weeks, we'll start getting portions of it. However, we applied for another CARES ELC funding stream that allows for testing, and it was $156,880 to be exact. That if the state were to stop paying for testing, and it would allow us to implement our own facet of testing to keep our community info coming into us.
Was the server at Castillo's who tested positive wearing a mask while working?
So answer that, but we'll say it again, is that no, she wasn't. But again, this is a good learning opportunity for all of us to be wearing our facial coverings. Again, it reduces the mask, I'll call that out as the medical mask that Joe's wearing reduces droplet transmission by about 60 to 70%. So it actually can be protective for the wearer as well as for the people around him. I'm wearing a 2-layer cloth mask that's pleated. That reduced droplets by about 20 to 40%. It's more protective to other people than it is to me, but it does provide me a slight amount of protection. But if we all wear them, we reduce the risk significantly.
All right. Is Yosemite doing closures on anything?
So they will be following the same guidance. I'd like to just emphasize that Yosemite and the leadership team there has been great partners with us. And so they will be mirroring what the state is doing. So they will be moving to close their dine-in facilities where there isn't the opportunity to eat outside. Same with their bars. So that will affect operations there. But again, they'll still have the opportunity to do takeaway dining as well as other services.
All right. How many more positive cases in Mariposa County will place us in a monitoring county status?
So it's cases over time. And so if we get roughly more than 20 cases in a 14-day period, that would go ahead and push us into that limit. The other things that we look at is an increase in number of hospitalized patients, more than 10% over a 3-day period. And then in terms of availability of ICUs and ventilators, that doesn't necessarily apply to us, but if I see a lot of patients that are being flown out to ICUs or being placed on ventilators, that would be the third trigger.
All right. And as we mentioned at the top of this, Dr. Surjanko is going to have to jump off. He has a call with the state. So this will be our last question. If we did not get to your question, we will have our team go through and respond to all of the questions. So last question, can you please state all known symptoms?
I'm going to say no, but because it's a long list. We started out by saying, those 3 key features: new or worsening cough, new or worsening shortness of breath, fever, there we go. But what we're also finding is that other symptoms have been involving. So GI symptoms, nausea, vomiting, diarrhea, headache, muscle aches and pains, joint aches and pains, conjunctivitis. I think one of the interesting ones in telling features is loss of taste or loss of smell. And really, I'll throw out one of the most specific combination of symptoms is that if you have a combination of loss of taste, loss of smell, along with a headache, you most likely have a COVID case. So those are the ones I can remember off the top of my head. There are other lists going forth, so we'll post that as a Facebook message, but again, those are the ones that come to mind, so those are probably the top 10, but lots of other things behind that.
All right, and again, thank you all. I know there are many questions that we were not able to get to today. We will have the team going through and responding to everything. Those answers should be able to come out around tomorrow. If you have more questions, you're also welcome to email us at mariposacovid19@gmail.com, or you can call the call center and leave us a message at 209-259-1332. Thank you all for joining us.